I would like to give you now a little bit of my experience concerning the Thuja patients. In my teaching in general, I have said that we can prescribe on three parts of symptomatology. The first is prescribing on the essence, as I call it, on the case. The second is prescribing on the totality of symptoms, and the third, prescribing on keynotes. So a remedy must be examined according to, with that idea. I mean, what is the essence of the remedy? What can be the totality of the remedy? What are its keynotes? So therefore, we may be able to prescribe either because we have the essence, or because we have the totality, or because we have the keynotes, or because we have certain essence. You see, you feel this is a natrium muriaticum type rather, not full essence. The symptomatology gives quite a lot of natrium muriaticum, and he has also a keynote of natrium muriaticum. Tell me a keynote of natrium muriaticum. What is? Worse 10 a.m. Until what time? Until 3. If it is until 4, which is the remedy? It can be as acute as that. What is? No? No. Can be stannum. If it is exactly at 10 a.m., not 5 past 10 or 5 to 10, but exactly regularity, clock regularity. Exactly to 20 to 10 or 5 to 10 every day. Then what is the remedy? Sidron. Sidron. Well, to see the essence of Thuja, it has taken me quite a lot of time and years of observation before I could conclude a few points that were definitely there. Well, I shall examine the Thuja case from the mind point of view, emotional point of view, and physical point of view, and give you my observations in all these three levels. What has impressed me with the Thuja cases is a tendency they have in the first stages to have a tremendous confidence in themselves, the I know everything attitude. Whatever they think, they feel it is right, and they will tell you outright. They will tell you very openly. You see, there is no friendship in this world. I'm telling you, my friend, there is no friendship. I have concluded there's no friendship in this world. There is no such a thing as friendship, and they will give you their opinion and you cannot argue. You feel neither they like you to argue. That in more basic types, it will appear as almost outright lies. They will tell lies in order to make one point, to make their point. So in the beginning, there is that type of, what do we see in that? I'm telling you, it's this. We see a kind of fixed ideas. Fixed ideas is an idea, you know, a fixed idea. It is like that. A kind of crystallization, a kind of sclerose, a kind of something which has become sclerosed. The prodromal state of arteriosclerosis that may come after 10, 20 years. Or what the Thuja patient is known to have as an idea. It's not warts only, it's fibroids. It's fibroids, which is another tumor which is hard, nodules, tumors in the ovaries, prostate gland which is swollen, glands that are swollen, tumors in general, sclerosed, hardening of tissues, of certain tissues, with the idea of producing tumors either from benign to malignant, all types of tumors. So this idea comes very fast, but after they go through another stage in their pathology, in their mental pathology, what do we see in the Thuja cases? They are more refined. They are more refined individuals now. We have another stage of pathology, and what do we see as a main idea? Where it was, this is what I'm telling you. Now, they have been unbalanced, and they will feel that they cannot be sure about anything. Doubt is the big word. They doubt everything. They have vacillations, doubts about everything. Eventually that state will end up in a kind of confusion. The doubt it's very interesting, where they hear a point of view, they will hear a point of view, and they will doubt it. They will hear a thesis, and immediately the immediate reaction is to doubt it, not to believe it. They become great disbelievers in anything. It is the Thuja scientist is the scientist that you try to persuade. You bring the most persuasive kind of arguments. You see he's almost persuaded. I mean, he feels he has no argument anymore, and yet he keeps the attitude, may not be so. There is a kind of suspicion, a kind of not believing in having lost the immediate contact that each of us have, and the possibility to interact in a straightforward manner. Therefore, what you get as a feeling when he is in your office? You get the feeling, first of all, that he is not giving you information that you are asking for. Sometimes you have the feeling almost twisting the information. Sometimes you have the feeling that he's testing you. I have seen Thuja cases where they come and they give you the symptomatology. You see, I have been feeling so badly yesterday, and I had this crisis, etc., etc. And then you come to the conclusion that most probably is your blood pressure, which is low. Let us examine it. You examine the blood pressure, it's normal. They will not tell anything. They know where the crisis have started, but they test you all the time to see whether you will get the point. Finally, you say, perhaps your stomach is upset. I mean, did you eat some heavy food? He said, yes, yesterday I ate a lot of heavy food. He knew that from the very beginning. He will not come and tell. You see the difference. Yesterday I had a lot of food, I drank a lot of wine, and then I felt very bad. I went to bed and I felt almost dying and fainting, etc. And today he has come to your office. He will not give you that information. See the difference, how we start to differentiate and to understand a little bit of the inner workings of Thuja. They will give you whatever, you see, these people now, I shall try to describe as much as I can, you see, but it's very difficult to communicate that knowledge, which is a knowledge which is on a level which is not, you cannot touch it. As they go through life, they attain a character which is very calculative. They calculate everything. And they will give you out whatever they think it is to their interest. That attitude, you see, requires on an emotional level a kind of sclerose attitude, a kind of hard attitude on emotional level also. They are hard and they lose eventually the tenderness, the natural tenderness which is natural for man, even to feel for his wife, for his children, for his environment. They lose this natural tenderness. They become hard and therefore manipulative. You see, because emotionally are not investing themselves into interactions, they are withdrawn, closed up to themselves, and manipulatives for others. They will manipulate you also. I mean, you may have a very hard time treating a Thuja patient until finally you understand the whole pattern. He's not giving you exactly information. You say at the moment, you are aggravated by heat or cold. Simple question like that. He says, by cold. Oh, he says, you cold. Very much? So he sees you are interested in that. He gave you information, you are interested. He will change it. He says, now cold, sometimes, you know, I'm in a hot place and I have this reaction. And you forget about the information. You go further. You say, are you thirsty? You drink a lot? No, I don't drink a lot. You mean you don't drink at all? No, there are some times where I've drunk a lot, you know, I'm very thirsty and drink a lot. As soon as he sees that you are interested in any information, he will withdraw. Why? Because in his mind, he thinks, I'm giving information, maybe it's not right. Maybe I'm not telling exactly the right thing. He's so doubting his own observations, his own feelings, that he's not anymore able to give. That state will go on into total confusion. People will be unable, Thuja cases will be unable to affect a decision because of that state. You see the feeling now, the feelings are hardened, the mind is becoming fixed in certain ideas, the person is withdrawn, he feels a kind of animosity around him, He does not want to be manipulated by others. He's very careful on that point, and therefore manipulates other people. With the effect, what happens later on? That he goes through all this either consciously or unconsciously, and he develops a very strange, a very strong guilty feelings in the conscience. Guilty feelings in his conscience. And there is a guilt which underlies the Thuja person. If you go deep really and you make them talk, you let them talk, there is a guilty feeling which will always come up. Why? Why? See the connection. You see, the type that have become, they are Thuja cases. So with stresses in life, the Thuja element has come more and more. What is more and more? To become more hard, to become more closed, to become more calculative, to become more manipulative. So therefore they manage finally through this ability which they have developed to manipulate others. But to manipulate others, it means someday you have, or other you have to pay for that. How? By developing a guilty conscience. So what do we see? Now, we come to the sexual sphere to see how he behaves. In a kind of relationship that they develop, the emotions are not vested in the stages where Thuja is affected on emotional levels. In the beginning stages, there will be strong attachment to pleasure. You see, the idea of Thuja is, I will give you another example. I think Kant writes that the skin of Thuja is yellowish, waxy, earthy, glistening and greasy. That skin, that it gives you the impression that goes towards the earthy color. It is the idea of Thuja progressing into pathology, becoming earthy. The idea of the idealism which is natural in men and in women. When I say men, I mean women also. This idea which is natural to be, without ideals we cannot live. In Thuja, because of the calculative aspect which is calculated, he is going towards the materialism more and more. So you will see in their progressing into pathology that they are going towards losing their idealism more and more and going towards the earth side, the material side of their selves. So therefore there will be, hard people, what they say, these people that they make transactions and hard bargainers. Hard bargainers, matter of fact, very ruthless, no sensation, no emotions. Huh? You get the type now, a little bit. So he will be hard, calculative, manipulative, he will not give you information, he will test you, and then you are lost. Because you learn in a transaction, and then you find out that with that person it's difficult to have a transaction, to have a rapport. It's very difficult. And eventually he becomes unable to express emotions. Unable to express emotions. Not that they are not there. The emotions are there, are inside but under control. And when they go into, as I said, into relationships, the relationship is mostly to satisfy the earth element, the materialistic, the physical element. The urge is to satisfy that element mostly, and therefore emotional attachment does not occur. Therefore, they become what? It's natural. Then they become promiscuous. Promiscuous. If you do not have a real rapport with a person, then you can go with another, and with another, with another, with another. Then promiscuity is within the sphere of action of another point which I want to clarify concerning the skin. The skin of Thuja is not always like that, as I described. There are cases that have progressed already, they are going towards malignancy, that they have this type of skin. If you see that type of skin, you suspect malignancy is coming in a short time. But not that every Thuja case will have that type of skin. In the beginning, the skin can be red and can be any type of skin. Do not be misled to believe that every skin, I have seen it very few times, that type of skin. And I have seen it in either children that are retarded, where you see a real malignancy, or I've seen it in cases where they're going towards cancer. But in between, the skin is normal. And therefore, we have emotions inside which are alive, which are excitable, but a sense of satisfaction of the physical level. Then the emotions are aroused, the sexual sphere is aroused easily, promiscuity as a result, and eventually what? Eventually? Illness? No. Eventually we have indifference to sex. Indifference to sex. We have either indifference or we have even inability. One has to see the unfoldment of our remedies, because if you see what's called inability, what's called impotency. If you see impotency in men, you say Thuja. No. Thuja can be very easily aroused, not attachment at all, sex, promiscuity, and then eventually is indifference, and then finally is impotency. Where are other remedies, if we want to compare, like lycopodium, like Staphylococcus aureus in this area? What do we see? Another story altogether. Impotency there also. Staphylococcus aureus is impotent, but for another reason. Lycopodium, impotent, for another reason, close to that reason. But take Staphylococcus aureus. Well, as I'll be talking, I shall give you on another time. In later stages, you will see the guilt of consciousness becoming an anxiety, a real metaphysical anxiety about, shall I be saved? Shall I be saved? Because all these questions, they're going through the mind. It's not that they don't think. They act, they react in this world, they do things, they get involved, but then there is something inside them which criticizes themselves. And they criticize themselves and they ask, well, what's going to happen now? And there is this element of great anxiety about their salvation. At that moment comes a state of loathing of life, the dissatisfaction, and they don't want to live. They don't care if they live. There is no suicidal. In Thuja, there is no this strong suicidal element, but they just are disgusted with the life that they have lived. They will tell you different stories. The fact is that they are not satisfied themselves, inside themselves, with the life which they have lived. It is Thuja that have led them towards this path to follow. It is their constitutional, because what we are talking about now, it's the constitutional type of Thuja. As the pathology progresses, we may see memory which is failing and a lot of mistaking in writing. Sometimes, many times, omitting letters in writing. One thing I have observed also in Thuja is strange. You see, there is, with sex, I forgot to mention, is periodicity. In their sexual activity, you see, it is a woman naturally has a periodicity in her sexual activity. Men does not, as a rule. With the Thuja patients, you may see periodicity in their sexual activity. Like women, you know, where the ovulation period, usually it's normal that the woman has more desire for sex. It is almost like that with the Thuja. They can predict the time when they will have strong sexual desire. Then what we see as a general pattern of Thuja, it is this growth in general. In the history of the person, we shall see it's not only words. You may see a history of melanoma. You may see a history of women of fibroids, of nodules in chest. You see, I have here some notes, and because they circulate a lot, I just want to make a correction. I know that they circulate, and these are notes by one of my first American students who came to, Bill Gray, who came to Athens to study with me, and we wrote some materia medica. I just gave verbatim, and he says here, somewhere, I just saw it today, the closest we can come to describing a patient is by the words ugly and deceit. These are too strong words. You see, it's not ugly, it's not, there is a deceitful element there, yes. And there is something which it is not nice. But to express it in this way, it gives you a very wrong impression of the type. We all belong to a remedy that has some kind of ramifications upon mental emotional level. And when we describe a remedy, do not ever think in your mind, oh, it's a Thuja. No, they can be very nice people in the interaction. What is more? They can become, because of the doubt which is in them, you see, do I give the right remedy or the wrong remedy, if they are doctors? Then becomes a great impediment for their progress in homeopathy. That doubt element is so strong that they will consider, oh my God, if I give him something, then I'll do something wrong with him. So that will make them draw back. So you can explain that as a sensitivity towards the well-being of others, where with Thuja actually will be that doubt element. Is it right what I'm thinking now, or is it wrong? There is a point which has reminded me very much of Thuja patients. and which says, I think by Keats, is an English poet, Keats, where it says, they doubt and sigh and do not love at all. Of these am I, of these am I. This is the poem that says, they doubt and sigh and do not love at all. This idea, maybe he was Thuja himself, where he was writing that poem. It's exactly the state of Thuja. They doubt and sigh. You see, inside the dissatisfaction, and they doubting about everything, and they cannot love. Of these am I. It's a very, very good description of Thuja. Always the element of the case being unclear. You see, Kant, he was giving advice, and he said, when you have a case where you don't know what to give Thuja. Because he was facing the same problems as we do. You see, to give Thuja, also, when you don't have symptomatology, give sulfur also. That's another idea. Or give sorinum. Which one? These are the elements that will give you the idea. You see, by knowing your patient, now we have prescribed in Thuja cases. Usually we prescribe 3 remedies wrong before. It is by chance if they come and they will tell you, I had warts that they have been suppressed, and no other symptomatology, and you prescribe on that keynote. And many times you have effect, of course, just prescribing on that keynote. But it's not always the story like that. And if you don't have this keynote, most probably you're going to prescribe the wrong remedies, a series of wrong remedies in a Thuja case. I just remembered now a characteristic that you have to remember with Thuja, and you may see it in retarded cases of children. It is the hair. The hair looks like strings. It goes up like that, like what's called this animal? That animal? Yeah. But so strong, I mean, it is impressive to see a small child with that type of hair. And when they are so dry and hard, the hair, this is like wires. This is a characteristic of Thuja. And the dryness of the heart, the dryness on the emotional, on the mental level. You see, when a person loses the ideas which serve in order that we evolve spiritually, when he loses this, then degrades the person. Then there is a dry up of ideas, and then the fixed ideas comes. And Thuja, on later stages, has a lot of fixed ideas. So there is a dryness, you remember, in the hair. There is a dryness where else? Where you will find mostly dryness in Thuja. On? Underfoot? You see, there is a very great characteristic. I don't know if it's mentioned in the book. It is dryness of the nares, of the nostrils inside. Thuja patients, they will describe to you such dryness in the nostrils that every night they go to bed, they have to clean up with their finger. They have to clean up the dryness which has a crust now formed. And they have to take this in order to relieve this tremendous dryness and be able to sleep. So there is dryness in the hair, dryness in the nostrils, where in the face usually we have excess of grease. There's a greasy. I have rather a greasy face. Do we have in Thuja fear of death? Usually not. If it is there, it's not great. Do we have in Thuja anxiety about health? Usually not. If it is there, it will be minimal. What type of fixed ideas we have in Thuja? There are certain characteristics. The legs are brittle.
Made of glass.
Yes, made of glass. And? In the abdomen also. In the abdomen, what is in the abdomen? The feeling of something alive in the abdomen. The body in general feels very delicate. This is the idea. I mean, to make them tell that looks like glass, it's difficult. Because sometimes you will ask them, you know, and they will not confirm it. But the idea that the body is delicate and it might break, you see, it might break, yes, they say, yes. You see, there is a confirmation. But is it made out of glass? They don't like this description. You see, but in our books, most probably Kant heard it once, but you will not get it every time like that. It's the idea behind that there is some kind of delicacy, is what we eat. Brittle, yeah, brittle. Sometimes he will have he may have the impression that there is something alive which talks in the abdomen. And sometimes you will find a symptom which is with agnus castus and with argentum nitricum and with aconite also, that they have the feeling that they are going to die at a certain time. Thuja patients have a strong aversion to be touched. They don't like to be touched. And of course, in the end stages, you will have aversion to mental work. Aversion, there is dullness, confusion, and aversion to mental work. in the head, except of the dryness of the hair and the falling of the hair, which is quite strong with Thuja, we have left-sided headaches, frontal headaches, and these pains can be alternated by pains on the back. You see, either you get here the pain or you get in the cervical region. The type of pain for Thuja is mostly like a nail, they will describe it. This is the general description that you will get. There is a time of aggravation of the headaches which is around 3 to 4 a.m. And with the Thuja headaches, it is a keynote to be ameliorated walking out and aggravated also. They can be strongly aggravated by walking outside on the air, and they can be ameliorated by walking out. Both can be Thuja cases. Of course, do not forget the starting of the case after smallpox, which I think we don't see so much because the smallpox vaccination has been abolished lately. But if we do have such a case, we can prescribe it as a keynote. And of course, do not forget the tumors, which can be everywhere. Can be in the eyelids, can be around the mouth, and there is a type of eruption which is typical for Thuja, which is here exactly on these two points under the lower lids, and they are symmetrical. When there is a history of styes in the eyes, which become indurated, they do not subside, but they become indurated and they remain for a long time. Whenever you see the induration, whenever you see this hardening, whether it is on the glands or whether it is in any side of the body, when you see the history, just think of Thuja. The possibility of Thuja is there. And there is also something else which you will meet either in the ear or in the pharynx, which indicates Thuja. It is, what condition is this hardening? We have it in polypus. You see, with the nose, except of the dryness, which I have found it very frequently with Thuja, in our books it is said that the nose runs during stool. And Kent describes that very vividly, I think, Kent. I have found this symptom a few times, but Thuja did not work. You may get, other remedies also, that they may have this symptom which is described only for Thuja. Most probably other remedies have it as well. And I have not seen it working with the Thuja patient. There are warts around the nostrils, and there are ulcers easily ulcerating inside the mucous membranes, ulcerating. Warts which are located only here on the chin will indicate mostly only thuja. I have seen it in a child of 8 years old that was ready to be operated. It was full of warts on that side. And one dose of thuja took away the situation. There is sometimes you may have a kind of trigeminal neuralgia which will have an aggravation time in the early morning hours, 3-4 a.m. That can indicate thuja. There are some other keynotes with the stomach. Now, do you remember some? Do you remember keynote with the stomach?
Aggravated by onions.
Aggravated by onions, yes. That is a fact. Thuja do not like onions. Or they like it, but they are so much aggravated they avoid, they cannot eat. Now, which are the remedies also which are aggravated by onions? Lax vomica, pulsatilla, and lycopodium. In the abdomen we have that feeling of something being alive, especially on the right hypochondriac region. In the rectum we have condylomata and fissures in the rectum. With hemorrhoids that are very painful to touch, very painful to touch. In the urination, what is the main the forked urine, the forked. Many times, the patient has a forked urine. What is this? What do you think it is? Restriction. But it's not always. It's many times, but not always. Yeah. It is a kind of, most probably, discharge which is gluey, that is a chronic state of the urethra which sticks the urethra together and makes the thing. So therefore, thuja will be indicated in cases where either there is a chronic gleat, a chronic discharge, a chronic non-specific urethritis, they call it, or if there is a history of gonorrhea, then condylomata, and then leukorrhea. A history of that type which has been disappearing, and now we have duodenal ulcer, or we have diabetes, it will require thuja. The prostate gland is indurated, especially when this has come because of gonorrhea history. The characteristic discharge from the prostate is what type? Is a watery discharge. That is a keynote for Thuja. Very liquid. From the urethra, if there is dropping of urine after urination, drops or the sensation of dropping of the urine after urination, then we have Thuja. A sensation as if urine has remained still inside. We have all kinds of condylomata, of course, in the genitalia, and a perspiration which is usually what? Perspiration of Thuja? Sweeties, yes. And also nasty. And honey-like. Yes, sweeties, this honey. With the woman we have all kinds of condylomata, polypus of the uterus, fibroids. With a woman there is going to be a history, you see, with the Thuja, with your Thuja patients. And this also you have to have in mind. You prescribe Thuja for a woman. Most probably the fibroids, which are say 1 inch, they will become 3 inches in 6 months or a year. You have to have that in mind. With the nodules that are small, they seem to grow after Thuja. If your patient is feeling very well and you are assured that this is not cancer, just leave it alone. But get the opinion of the experts in such cases. Do not expose yourselves. Even you are medical doctors, and you have to be very careful. The nails are brittle. There are ingrowing toenails. The time of aggravation in general, just remember 3 p.m., 3 a.m., more or less. It can be 3 to 4, either p.m. or a.m. I hope I have not forgotten too many things, but definitely I have forgotten quite a lot. Yeah. Thank you. Well, before I will proceed to the case analysis, I would like to talk with you about some theoretical matters. And I hope to be able to show you through the cases what do I mean by the theory I'm going to expand now. I believe most of you that you are here today, they are what we call constitutional prescribers. Is that correct? Correct. And we call ourselves this name, but I found out that perhaps we have not a clear meaning of what that is, what that means. So we prescribe on a case. And usually what I have found out from experience is that we prescribe on two different kinds of prescribing. We do two different kinds of prescribing. The one is prescribing upon a layer, and the other is prescribing for the layer. What do we mean by that? You will have noticed in your practice that you have cases where you have been treating for years, 1, 2, 3, 5 years, perhaps more. Treating these people successfully, and they are faithful followers of homeopathy. And you say, I have been able to help these people, always. But there is a background symptomatology, which, after all your prescribing, after all your careful prescribing, does not seem to change. What do I mean by that? I'll bring you an example. You have a case that comes for a lumbago, and you get the picture of calcarea phosphorica for that lumbago, and you prescribe it, and it does very well and takes away all the pain and the discomfort. And then the same man who is very enthusiastic because you took away the pains comes after 6 months or 9 months with a sciatica. And then you prescribe for his state a Rastox, and he does very well. And then the same man, after 1 year, he comes with an arthritis of the right shoulder joint. And you prescribe for him sanguinaria, and he's very happy to go away without pain. But as you take the case all the time, you notice that certain constitutional symptoms remain constant through your prescribing. What are these constitutional symptoms? First of all, there are some psychological, perhaps small, perhaps a little bit more disturbing psychological disturbances. The person has some kind of phobias, some fears, some anxieties. He has an irritability which is quite strong. He has some minor discomforts in the physical body. He is intolerant of cold. He's always thirsty for very cold water, etc. I mean, symptoms which are not very disturbing, but they form a background symptomatology which remains through your prescribing. After many years of observing such cases, you come to the conclusion that your patient has not really changed a level in health, in spite of the beneficial treatment that he has received from you. That kind of prescribing, I call it prescribing upon the layer. A person comes, I'll give you a more homeopathically accurate description. A person comes to you with the symptomatology of a grief. This person, if he had come before to you, and you would have taken his case, you would have seen a case of natrum muriaticum. He comes now during the grief. You take his symptomatology and you see the symptoms of Ignatia. And you give Ignatia. and he does well. His grief is relieved and he does well. But you do not go further and give the natrum muriaticum, and the person remains relieved, but on his layer, which was most probably natrum muriaticum, another picture, another layer has been imprinted has formed due to the grief, and that layer is now Ignatia. Is it correct to give Ignatia, or is it correct to give natrum muriaticum? This is the question that you have to face. Also, when you see the case of calcarea phosphorica, rastox sanguinaria, where underneath is a constitution of sulfur, is it right to give calcarea phosphorica, etc., or it is more correct to give the sulfur, which is underneath? Well, the answer is that if the symptomatology was really Ignatia have to be given first and then natrum muriaticum. If the symptomatology was rastox, first rastox and then sulfur. If you go straight to sulfur at a moment where there is an uppermost layer which is called Ignatia or rastox or calcarea phosphorica, if you go underneath, there is not going to be an effect, because that layer, the Ignatia layer, prevents your natrum muriaticum from acting. And this becomes really confusing, because you give natrum muriaticum, you see the constitutional symptoms of natrum muriaticum, you see some picture of Ignatia, ignore Ignatia, give natrum muriaticum, nothing happens. And then, of course, you go to Ignatia, and there is a relief. And then you suppose that your natrum muriaticum is not doing anything good for that person. The truth is that natrum muriaticum is needed after Ignatia and is going to help him then, only then. You see how you may lose sight of a remedy which is underneath because you try it prematurely. And that happens, and this is the story, if we are prescribing correctly. But there is a possibility that, and that happens many times, that during treatment of a person, long-term treatment, what we do, we give a remedy in the beginning which is correct, which is the uppermost layer. Then comes for something else. We are in a hurry. We give something else which is very superficial and close but not exact. Therefore, we change a little bit the symptomatology without benefiting. The third time he comes, he has more problems, we give again a wrong remedy. Still little bit of changes, no effect. Then comes the fourth time, we may prescribe again the right remedy. But what is this right remedy that we prescribe the fourth time? Is the constitutional remedy? And that's the question. We are constitutional prescribers. The fourth remedy is the constitutional. And what are the parameters that will tell you that this, what I have given him, is the constitutional remedy? Who can give me these parameters? We have been talking about this subject before. And many of you have forgotten. The first criterion that we have given the constitutional remedy is that, of course, it has to cover the totality of the symptomatology. But is that enough? And what is the totality? Many times we do not know. Many times we are not able to ascertain what is the real totality. The second condition has to be, after we have chosen our remedy in the most comprehensive way, the first condition should be that as a consequence of prescribing that remedy, it has to come a profound change in health. I have seen cases, and I have prescribed some cases for 4 to 5 years. And I have seen severe cases. You know, they came to me with tuberculosis, which was active. And we started with tuberculinum and then calcarea carbonica and silica with deep remedies. The person is better, is satisfied. Yes, thanks to homeopathy, I'm so well. Yet, there is a picture which is in the background, and I cannot catch the picture. And after 5 or 6 or perhaps more years, I can't remember now how many years that particular case I'm talking about, I have been treated. And there comes one day, and I grasp the whole symptomatology. And I say, oh my God, this is the constitutional remedy for that person. What is happening in that case is that certain of these remedies I have prescribed for the past 5 years, certain of these remedies were right and were layers that we took away until perhaps 1 or 2 of these remedies were right, or 3, but not all 10. These 3 remedies took away the upper layers and let the ground free now for the constitutional remedy. What was the constitutional remedy in that case? It was baryta carbonica, where you have prescribed deep remedies and it didn't do anything. I mean, you should see the change on the health of that person, the profound change that took place. And you know how they express it. They say, I feel another person. I feel I'm free. I had this, I had that, I had that. Now they realize what was the slavery that they were in. And that remedy now becomes the constitutional remedy, perhaps. Still, we need some more conditions. Another condition we need in order to define that this is a constitutional remedy for the patient is, I have found out, that during the relapses, after the constitutional remedy has been given, the relapse will take the shape of the same remedy. That means, again, baryta carbonica. When they go into a relapse, usually they relapse into the same state. So therefore, what we notice with the constitutional remedy is that the person, whenever he has, whatever he has, when he relapses, always is natur muriaticum, natur muriaticum, natur muriaticum. And you take him through years of treatment, and the main remedy that helps this person is natur muriaticum. Sometimes you go away from that remedy and you prescribe another one, no effect, until you manage through bed prescribing to make him relapse, which is a fact that we all know, we all have done. And then when he relapses, really again comes to natur muriaticum, and then again you give natur muriaticum and he's helped. Now, why? You see, unless we know this theory and we understand this, we cannot withhold our impulse to prescribe for a person that comes and gives us some little kind of symptomatology. And every time prescribing for every little symptomatology usually brings about a relapse. But sometimes it may confuse a little bit the case. It's very important, I feel, and I have felt all through my experience with homeopathy. It's very important to know at every moment what are we doing. It is important that when we give a remedy, the person will come back and will say this and that. And we are able to translate that into our language, and I will say, wrong remedy, completely. Placebo effect. Closed remedy. The remedy was closed. Has just changed. Just be true with ourselves, you see. The symptomatology has been touched a little bit, but no real effect. And which is that case? When you have the headache on the right side, frontal headache on the right side, which is the main remedy? When the headache is on the right side, a very seldom indicated remedy. On the left side here, on the frontal. Frontal headache on the left side is Thuja mostly. To the right side is Prunus Spinoza. But it doesn't matter this. When there is an extension of pain to the left occipital protuberance, then which is the remedy? Bryonia. When the headache is on the left side and takes all this side with a tendency to vomit, with nausea, is mostly sepia. So he comes on the right side, frontal headache, and we give Prunus because you're knowing it now. I've given you bad information to prescribe on a keynote. You give Prunus because you do not have any other symptom. Prunus. Then what you see, the effect, the headache goes away from here and after 2 days appears on another place. Then we know that this was the wrong remedy. I feel it is very important that at every moment we know what we have done with our patients. Another parameter which you will have to take into consideration in order to say that the remedy that we have given was the constitutional remedy is that relapse of that patient is difficult. He will not relapse easily. You see, I've heard cases where they say, we have given, the right remedy, and the person drank one coffee, and he relapsed. This information means that your remedy was not a deep constitutional remedy, was prescribing upon a layer. A person who has received the constitutional remedy will take much stresses in order to relapse. He may be drinking coffee for a year. He may take in a series of antibiotics. He may take in a series of other remedies to relapse. There is a resistance now. There is a jump in the level of health which resists tremendously outside interferences. So when we see that, also don't leave that remedy then. You see, do not go away from that remedy because the person will come and will tell you, my hairs are falling again. And hair was falling in the beginning. The hair is falling, but what about how you feel psychologically? Very well. Still, everything remains on a good level. You are tempted, you see, my hair is a woman. My hair, especially if it is beta carbonica or silica. Huh? Especially when it's beta carbonica, because they are so much concerned with their appearances. Beta carbonica is tremendously concerned with the appearance. So my hair is falling down. And you are tempted to repeat. You are tempted to repeat because of falling of hair. This is wrong prescribing. Most probably you will not be doing anything, and it is not correct. You have to wait. Let the season, because there is the autumn season where there is more falling of the hair. So as it comes to the autumn, you see, wait, give sackcloth, this divine medicine, so the pharmacists will be kept happy. We have to keep the pharmacists happy. We have to make the pharmacists strong, because the pharmacists are going, okay, we'll kill you better, I mean, than teaching all this teaching, you know, because we are going to die in the way that you teach. So the pharmacist must stay alive. Why? How? Because you have to prescribe placebo. Placebo is a fantastic remedy. It's not, we are not depending on placebo effects, because we know what is a placebo effect. When somebody comes and says, I am better, what is better? No, I think my headache is not so strong. I said, yes, wait a moment. I suspect immediately, I mean, this kind of reaction, it means most probably the remedy has done nothing and your patient wants to please you. I think I'm a bit better, yes. Not so, I mean, this type of answer I don't like to hear. I don't like, the person is very nice and he wants to be nice. But this is a placebo effect, you search for another remedy. Another point that you have to have in mind in prescribing the constitutional remedy is that sometimes there is deep tissue pathology which is not reversible, either because there is a mechanical obstruction or because the pathology is such that cannot be reversed. So, do not expect, you have given your remedy, the patient is doing well, psychologically, energy level is better, everywhere is better than your patient, except of that particular pathology which says still is the same. For instance, cases, I've seen this happening in multiple sclerosis cases, where there is a damage on the nerves, there is a plaque which is formed and which is dead tissues that cannot be rebirthed, regenerated. What is happening in such a case is that only the edema which is around will be absorbed, and certain of the symptomatology of multiple sclerosis will go away, certain. Some of the symptomatology will remain. If you expect, you gave, and now what happens in actual practice? You gave that remedy. The person did quite well. He's freed psychologically, his energy is better, as we said, he's walking better. But if that person is a 10-year patient of multiple sclerosis, for 10 years he's suffering with multiple sclerosis, do not expect that all his symptomatology will go away. There are damages that have been permanent now, and he's going to walk in this way that you see, that walking with great difficulty. And that's all. Stop there. If you try to push this case by repeating the remedy, by changing the remedy, by giving different other remedies, trying, what you are going to attain at best will be a relapse, a total relapse. At the worst is to start again the process of inflammation and degeneration of the sheaths of the nerves, and then the continuation of the situation. So we have to have that this is a condition where we cannot push any further. Also, when a person is overweight and the muscles are quite lax, and he has come with hypertension, with God knows what, plus a pain on the back. You give your remedy, does beautifully, his blood pressure goes down, his psychological state better, everything is better, but that pain remains in the back. That pain, now you try another remedy. If you have given the constitutional remedy, do not try to push anymore, because it's not going to happen. What you have to wait for the muscles to build up and to strengthen, give exercises, give mechanical support, but do not try to push again with a repetition of the remedy, because this is going to rather damage your good prescribing. And of course we may, in certain cases, we may have to use surgery and remove the obstacle through surgery. Let us return again to the first example where we have prescribing upon a layer, and see why a person will not respond deeper to your treatment. What are the reasons? The first reason may be that this person's constitution is undermined so much from a hereditary point of view that he has not the possibility to proceed further. The organism in such a state that has not the possibility to jump a level really, to have this tremendous volcanic kind of reaction that makes a person jump a level. He may not. His organism may have been undermined already quite a lot and not having that possibility. So never mind how carefully you may prescribe, the person will always remain in his life in the same level. There is no real change. What you are doing with this patient is that you are preventing him. These are cases that they are going to develop soon a type of malignancy. Not necessarily cancer, I mean malignancy on a broader sense. A serious chronic condition. By your treatment, you keep up the best of this organism and you keep him in a tolerably good condition. So learn to explain the patient. He says, I've done my best. Do not expect perhaps more. Do not promise your patients, because you do not know what you are going to face when you have a case in front of you. You see a case and you say, oh, he looks so healthy. And you take the case and there is no symptomatology at all to guide you. That is a bad sign already. And then you said, as you go along with this case, on the process you see some serious condition developing. Do not promise ever your patient anything. In our center, where 30 medical doctors are working, they are not allowed to promise anything. With homeopathy is so difficult and so sensitive a tool that we are using that we cannot be sure beforehand that the result will be there. Do not think, you see, oh, George is a master. There is no master for homeopathy. Never mind how much you study. I feel I have studied perhaps more than anybody in the world perhaps ever studied. And I feel a student still, and I don't know enough. And I never feel sure that this case is, the next case is coming, I'm going to help. It has been so that results that we had in Athens were quite high, and we have the respect now of the whole of the medical profession. But that is because of the agony and of the attitude that we don't know enough. Now this is a new problem, and we have to face, and we have to find a solution. It's like playing chess. There is one best move, only one. The best move is only one. You have to find it every time. It's not repeatable. So the attitude is it's a very serious matter to have the right attitude. Well, I shall give you now some